medicine. So let's start with the first question. There is the CSF specimen of a patient is shown below. The report shown the mononuclear cytosis with moderately low sugar with elevated protein values, which is following is to be the likely etiology. Here the question was like highly elevated protein. Okay, so it is only the keyword that can lead to our answer. So I guess I hope you all know the answer. Here the white white color proteins are seen in the base of CSF, and here you can see the this more neutrophils and in the smear, and so the answer will lead to the low sugar level and highly elevated protein are seen in the viral meningitis and tubercular meningitis. So here the highly elevated protein is seen, while the environment there is available less highly activated protein than tuberculosis. So the answer will be tubercular meningitis. The next question. ALD with ascites present with abdominal pain and tenderness. The acidic tap shows presence of 600 PMN cells per cubic mm. Which of the following is the likely etiology? So here you can see in the diagram there is a tender abdomen with the ascites, and the polymononuclear cells is 600 PMN. So basically here you can see the when there is diagnostic tap greater than 250 PMN cubic mm constant culture, so it is bacterial E. coli infection, and due to E. coli there is spontaneous bacterial peritonitis. So the answer here is spontaneous bacterial peritonitis. Other chylous ascites in the white color pus, and the malignant ascites also see the there is not that much malignant. Okay, and for tubercular ascites, that is the history of the tuberculosis should also be present. The answer will be not that. Next question. 32-year-old patient with the hypertension comes with the acute onset of breathlessness, chest phase shown below. What should be done next? Okay, so here the history of the hypertension patient and the acute onset of breathlessness. Okay, and there is no history of any smoking, no history of any other breathing disorder. Only the hypertension is given. So mainly and by the X-ray we can see there is a pulmonary hyperedema. Okay, pulmonary edema patient. So usually we are giving the Lasix for the pulmonary edema, but here in the option you can see nothing for hypertension or pulmonary edema, so except IV nitroglycerin. So the option answer will be IV nitroglycerin. There is no role of oxygen inhalation or antibiotics. The SpO2 level is maintained. The IV salbutamol is also not going to be work, and the nebulized salbutamol is also not going to be work. So next question. An adult patient complains of the palpitation and present with the irregular pulse deficit of 20, and the HR of heart rate is 120 per minute, BP is 110 per 70, and which of the following will be the found in this patient? So here you can see in the diagram there is irregular pulse, portier acardic, and diminishing sudden onset of palpitation, absent airway present in atrial fibrillation with this, then giant airway in the IV dissociation, canon airway is usually the ventricular tachycardia, and the third degree AV block. Okay, third degree AV block. So here you can see the absent AV in the atrial fibrillation. So here you can see the irregular pulse with the palpitation. So the answer, and the BP is also maintained. So the answer will be atrial fibrillation. So absent of AV is answer here. Okay, so the next question. Patient present with diagnostic intoxicity, pulse rate is 54 per minute with ECG evidence of third degree heart block. What is the best treatment? Okay, so the let's see the options. So lidocaine and phenytoin is used in the uh, atrial, it is used in the other biventricular ventricular bigemini, and DC shock is also used in the is also not the treatment in this option. So the answer will be digoxin imidacloprid. And can you tell me the dose and how many tablets we are giving? So we are giving 8 tablets of 0.5 mg. Okay, so the next question. 74-year-old patient with CAD, coronary artery disease, present with the palpitation, ECG shown below, PP 120/24, and which of the following shall be the best treatment for this patient? Okay, so here you can see there is by seeing the ECG, you can see there is a lot of tachycardia. So the 300 squares and the 1.5 square, so 200 bpm, right, beat per minute. Okay, so it is very high, and can't be usually can't be stabilized by the oral route. So we are going to give the IV route. So what will be the answer? So the IV, there are two options: IV metoprolol and IV imidacloprid. So metoprolol is in the high blood pressure, but here the blood pressure is 120/84. So the answer will be for tachycardia. We are usually giving IV imidacloprid. This is stable ventricular tachycardia. Okay, for stable ventricular tachycardia, the answer will be this. So next question: which of following is used to decrease the contraction of extracellular potassium? For decreasing extracellular potassium, so lactic acid is not the answer, because pH is constantly decreasing by pH is 1/K. Okay, so it will be, if the pH is less, so potassium will be already decreased, right? And atropine will be not using this, because potassium is causing bradycardia. So atropine is also causing bradycardia. So, and it's also don't decrease the level of potassium. Glucagon will increase the level of extracellular potassium. So the answer might be the epinephrine. So the epinephrine causes decreased concentration of extracellular potassium. So next question: a female who is non-case of diabetes mellitus and non-compliant to the medication is brought to the ER with abdominal pain, vomiting episode, and the recent onset confusion. On examination, she is dehydrated with systolic blood pressure 90 mmHg, and the workup shows the urine ketones present with RBS 598 mg percentage. Which of the following will be the next best steps in the management of the patient? Okay, so here the RBS, you can see the 598, and the patient might be in the ketosis. Okay, so in the ketoacidosis patient, we are usually giving and also patient is also dehydrated, okay, with 90 mmBp. So we are giving him the IV fluid plus insulin for the RBS. So the next step is with the IVF with the regular insulin. Okay. Okay. The next question: patient present with the teeth gap widening, frontal bone thickening along with the foot and hand enlargement. What is the first line of the treatment? So the acromegaly may be present here. So for acromegaly, we are usually giving the octreotide. Agvisomant is giving for pituitary gland, and bromocriptine and lepironide is also not given in this condition. For adrenal gland and pituitary gland, both drug. So the answer will be octreotide. Patient present with recurrence of pituitary tumor over producing growth hormone, which of the best one? Here for the growth hormone, we are giving the pegvisomant drug, octreotide and bromocriptine and answer in GHR and analog, we already know that. Here the GH analog inhibitor is used, which is Peggy's format. Okay. The next question, identify the device shown below. This is the non-rebreathing mask. The answer here will be non-rebreathing mask. Edson mask is the simple mask. Penti mask is usually biped mask, and the hydronical vanilla is other instrument for oxygen delivery. Truck driver present with the sudden onset of breathlessness, vitals are stable. He was found to be HIV positive and having pleural effusion. The culture of the pleural effusion, so the temperature of dependent diagnostic growth at 25 to 37 degrees with rapid and what is the positive result. PG is giving the cyst while we are doing the bronchoalveolar lavage. Okay, so it will be not the answer. Then the candida fluconazole, the candida also showing the white color pigmentation, so it will also not be the answer. Then the blastomyces, which is showing the yellowish coloration, and so it also did not answer. So it is red pigmentation. The red pigmentation is so the Delaromyces marpeni will be the answer. The photoresin is treatment of choice for Delaromyces marpeni. So next question, an old age smoker present with the respiratory difficulty, ABG report decrease pH 7.2, so it is acidosis. PO2 is 75 mmHg and the PCO2 increase, so it is the respiratory acidosis. Okay. Which of the following electrolyte imbalance will you produce ECG finding of ST depression and U waves? Okay, so the ST depression is there and also the U wave is also present, which is usually for the hypokalemia. It will be hypokalemia. Okay, so next question, young female present with the left side throbbing headache and she is also nausea, vomiting, or other phenomena. What is the best treatment for the immediate relief? So the best treatment here will be the sumatriptan. Sumatriptan will be the treatment for the patient. 25-year-old patient present with the multiple injuries due to the RTA 2 days later in the hospital. He developed dyspnea and the critical which of the following is supposed. So the dyspnea with the critical is usually seen in the PET embolism. If there is thromboembolism, there will be the hemorrhage early. Okay. And in the air embolism also there will be a hemorrhage early, because here after 2 days there is a dyspnea with PET bleed. So the answer will be the PET embolism. So which of the following is not found in the MEN B sickle syndrome? Okay, so meganeuroma is seen, megacolon is seen, Marfanoid habitus is seen, but the parathyroid adenoma is usually seen in the 2ME and 2A. Okay, so and the answer will be the parathyroid adenoma. Obese woman came to OPD with the dark patches on the neck. What could be the diagnosis? Here you can see the patches are seen. Okay, patches are not seen in hyperthyroidism or Addison disease. You might not see this kind of patches. So the answer it is the acanthosis nigricans. Okay, insulin related disorder. So answer will be the metabolic syndrome. The next question, the child present with epigastric pain, vomiting for the past 10 days with oliguria and the features of dehydration, peripheral smears to the presence of lymphocyte. What will be the immediate management? So here the oliguria and features of dehydration. So we are usually giving the fluids for the treatment. So hydration is the first choice. USC can't be sent first due to oliguria. Okay, and there is a cancer chemotherapy is also needed, but first we have to treat the symptomatic. For that we are giving the pints, and probenicid is also the part of chemotherapy. Okay, so the answer will be that. Moving to the next question. Okay, so it's over. I hope you will get a lot of knowledge from this session, and you will like and comment what kind of improvement in this video should I do, and subscribe my channel and share to your WhatsApp groups for other people also get knowledge, and thank you very much for being here.